task here this morning is going to be very brief, and as you've already heard, I have been advised to be as brief as possible. And I'm going to do exactly that. Dr. Michael Lisbo from WHO, Monica from Bill and Melinda Gates Foundation, Dr. Sheila Macharia, Professor Craig Cohen, Dr. Velepi Okello, Ms. Veronica Leburu. I can also see here in the audience Dr. William Maina, Dr. Isaac Bashir. Ladies and gentlemen, good morning. It is indeed a great pleasure to be here this morning to play a simple task of inviting the chief guest this particular morning. We are happy as Kemri to be co-host of this particular important conference, and I also want to thank the NASCO program and the Division of Reproductive Health for being with us at the hosting of this important conference. This conference, as you've heard, talks about integration. The key word since we came here has been integration. And I believe if we had all the money on earth, and I believe Monica I say I cannot talk about money, when Bill and Melinda Gates Foundation is here. But if we had all the money on earth, then the issue of integration will not be important. Because if you are dealing with family health, you could deal with family health and deal with it exhaustively. If it is HIV, you deal with it. But because we are in a developing world, of course we do not have all that money. So it is very crucial that we integrate our services. Because if you go to other places, for example, northern Kenya, and imagine you had just one center there dealing with HIV, maybe the next center dealing with family health would probably be several kilometers away. In fact, could be even 400, 500 kilometers away. So it is very important for us to integrate services so that when a patient goes to a particular clinic, that patient should be able to get all the available services that that patient requires. So the essence of this conference is basically to see how that integration can be rolled out in all our services. We are happy that there are quite a number of countries that are participating here. Initially we thought we were going to have 13 countries, but we are told that now we have more than 20 countries represented here. So I want to thank you all for coming. I do not intend to speak any longer than that because I have those specific instructions not to do that. So I just want to invite, really, Mpoke. Mpoke is the Secretary of Administration, Ministry of Public Health and Sanitation. He is the one who has been requested to represent the Minister of Public Health and Sanitation, who would have really wished to be here this morning. In fact, we were discussing with her last evening, and she had prepared to be here, only that there are other very urgent issues that have cropped up, making her not able to be here. Nonetheless, she has sent a very senior official within the ministry. We've worked with him very closely. The Ministry of Public Health and Sanitation, as you all know, came reports under that. And we have received every little possible support that we require from the Ministry of Public Health and Sanitation. So every time we request them to assist us in important functions, like even the opening ceremony of a function like this, they are always there to listen to us. So without really further ado, I kindly request Mr. Musyimi to come and officially open this function so that the rest of us can remain here to deal with integration, because that word integration should be the take-home word from this conference. Thank you very much.
Thank you, Dr. Mpoke. Yes, as he has actually said, our Minister, Honorable Beth Mugo, was willing up to actually 6 p.m. yesterday to be with us today. She indeed wanted to be here, but due to some very important assignment that she had to attend today, this morning, she could not come. But she sends her greetings and indeed welcomes all of you, particularly those who have come outside the country. You're most welcome, and she indeed sends greetings to all of us. And my duty indeed today is on our own behalf to read our speech today, we should have delivered today, during the official ceremony on the Integration for Impact Conference, Reproductive Health and HIV Services in Sub-Saharan Africa. Dr. Bisbo of the WHO, Monica Eredian, Dr. Sheila Masharia, USA, Kenya, Craig Cohen, who is with us today, Dr. Solomon Mpoke, the Director of KEMRI, Dr. Okello of Swaziland, Veronica Leburu, Botswana, Isaac Bashir, Dr. William Maina of NASCO. It gives me great pleasure to join you all in this important gathering to deliberate on an important issue, the issue of improving health through enhanced access to reproductive health and HIV services. The conference will provide a forum to consider the evidence at hand on the impact of integrating HIV and reproductive health services, as well as discuss innovations for strengthening our response to the unmet needs of these services. But why has integration of these services become so important? Reproductive health and HIV services have similar characteristics. They have the same target populations and indeed desired outcomes. Clients seeking reproductive health and HIV services often share common needs and concerns, and integrating these services enables providers to efficiently, effectively, and comprehensively address them. In the realization of this fact, my ministry and that of medical services, with support from partners, have taken the lead in providing policy guidelines, including service delivery guidelines for reproductive health and HIV integration. The two ministries have been coordinating and spearheading these efforts through the Reproductive Health and HIV Integration Subcommittee. Some of the recent documents we have developed in relation to this are the National Reproductive Health HIV Strategy and the Reproductive Health HIV Minimum Package for Service Provision. Achieving good reproductive health underpins all the Millennium Development Goals, especially MDG 1, MDG 3, 4, 5, and 6. These MDG goals cannot be achieved if issues such as reproductive health are not properly addressed. And that means stronger efforts to promote women's rights and health, including reproductive health, family planning, and provision of HIV services have to be mainstreamed. Therefore, our role as a government is to provide access to quality reproductive health, including family planning services, maternal health programs, and the prevention, diagnosis, and treatment of sexually transmitted infections, including HIV/AIDS. Reproductive health is indeed not solely a health issue, but a matter of economic development, social justice, gender equality, and human rights. Ladies and gentlemen, the Kenya government is committed to making reproductive health a national priority, not only through the health system, but through supportive laws, policies, and actions in education, gender equality, social and political participation. These services and information will make it possible for people to be healthy and make informed decisions about their reproductive health and overall situations. With 3 years left to meet the MDG goals, especially MDG 5 and 6, more remains to be done, and therefore we need to seize this opportunity and strongly recommit ourselves. Allow me to quote His Excellency President Paul Kagame's statement while delivering his keynote address at the London Summit on Family Planning a few weeks ago. And he said, and I quote, "Family planning is a responsibility that families and governments cannot avoid or delegate. And therefore, it is important to forge partnerships to find innovative ways to address such challenges." End of quote. This statement underscores the collective responsibility of governments, researchers, and all other stakeholders to improving the health of our people. The public health community can help build cost-effective and sustainable national healthcare programs by avoiding missed opportunities that result from inadequate linkages and the integration of reproductive health systems and HIV service provision, particularly at a time when there is a great need to increase access to comprehensive, quality, effective, efficient, affordable, and sustainable reproductive health and HIV services. I want to take this opportunity to thank the organizers, sponsors, and the government of Kenya for this visionary initiative. The Kenya Medical Research Institute and the Division of Reproductive Health under my ministry, the National AIDS and STI Control Program, NASCO, Bixby Center for Global Reproductive Health at the University of California, San Francisco, and the Bill and Melinda Gates Foundation. I have no doubt that the deliberations and recommendations arising out of this conference will form a firm foundation for developing the future research agenda in reproductive health and HIV integration in sub-Saharan Africa. Finally, may I take this opportunity to welcome you all to this wonderful city of Nairobi. It is indeed my hope that you will take time off after the conference to visit and enjoy the tourist attractions that this country is known for, including the Masai Mara wildebeest migration. I thank you all for your attention and wish you fruitful deliberations during the conference. Ladies and gentlemen, it is now my singular honor and pleasure to declare the Immigration for Impact Conference, Reproductive Health and HIV Services in Sub-Saharan Africa officially opened.
Thank you very much, Mr. Musyimi, for that official inauguration or opening ceremony of this international conference in Sub-Saharan Africa. We appreciate your time and effort in terms of supporting this. It's now my role to give a vote of thanks to all those who participated in this conference, from the planning, its implementation, its coordination, up to now. Allow me to mention a few. And I'll start with the Ministry of Public Health and Sanitation through KEMRI. Well, first of all, allowing this proposal to be passed and approved, and allowing this conference to take place in this country, and at the same time using the Ministry of Health workforce, specifically KEMRI, DRA, Division of North Health, and NASCOM, in putting together with our partners, in putting together the planning committees of this conference. The committees were represented by very many organizations, and allow me to mention all of them who are in the planning committees. We have the African Population and Health Research Center, the Big C Center for Global Reproductive Health at the University of California, San Francisco, the Center for Adolescent Studies, the Division of Reproductive Health, NASCOM, National STI Control Program, Family Health Options Kenya, FHI 360, International Planned Parenthood Federation, Kenya AIDS India Consortium, Kenya Medical Research Institute, KEMRI, Liverpool VCT Care and Treatment, LVCT, Pathfinder International, Population Council, PSI Kenya, USAID Kenya, UNFPA, and World Health Organization from the country offices. Next on my list will be to thank Bill and Melinda Gates Foundation for supporting this conference financially and technically, and we really appreciate, and you can take our word forward to the foundation that we are happy with this conference and with support. Dr. Mike Bizio from WHO, all the way he flew to participate in person as a director for reproductive health and research. We appreciate your time, effort, and your input. UNFPA country representation is here. Dr. Sheila Masharia and our immediate boss is here also. We appreciate the USAID Kenya office support, and also the implementing partners, the national and international NGOs, together with our international experts, especially government representation, and specifically from Dr. Okello from Swaziland, and Veronica from the government of Botswana, and all the other countries that were represented in this conference. We really appreciate your time, effort, contribution to make this conference a reality, and we hope the deliberations will form firm foundations for policy change and for scaling up of this integration for the benefit of humanity in the world. Thank you very much. I don't want to forget the civil society organizations and the local NGOs. We appreciate your efforts in implementing all these programs. So it is an effort for all of us to be together to really realize this dream of changing the indicators, especially the MDGs, and in the before 2015, which is 3 years, we hope to see some results. With those few remarks, I want to say thank you to all, and I want you to thank yourselves, so give yourself a clap. Next on the session will be a break for tea. I think you deserve that, isn't it?
Yeah.
And you thank me for managing your time very well. Clap for me. Thanks a lot. Then we'll meet here. Break sessions will be, there will be 2 breaking sessions. One will be in Jambo Room, is here, and that will be chaired by Dr. Solomon, is on issues of models of RH and HIV